Hi, I am Aurel Enriquez, and this presentation contains our discussion on blood vessels. This would also be the third part of our discussion for the cardiovascular system. So we're done with the human blood, we're done with the heart, so let's now proceed to the blood vessels and circulation. This is something that we've already mentioned when we were discussing the blood flow through the heart, di ba po? We have pulmonary blood vessels and systemic blood vessels. So pulmonary vessels would transport blood from the right ventricle through the lungs and then back to the left atrium of the heart. So ang mangyayari po, no, yung deoxygenated blood or the blood that currently does not have oxygen, dadaan sila sa right ventricle, pupunta sila dun sa lungs. Pagdating dun sa lungs, tsaka sila makakakuha ng oxygen. Alright, so at the lungs, the oxygen would start binding to the hemoglobin of the RBCs, and then after that, they would go through the left atrium. Alright, so yung mga blood vessels po na dinadaanan ng blood natin as it goes through, or as it goes back and forth from the lungs, no? Those would be referred to as the pulmonary vessels. So kahit anong may kinalaman po sa pagpunta at panggagaling sa lungs, no? That would be the pulmonary vessels. Next, the systemic vessels would transport blood from the left ventricle through all the other parts of the body and then back to the right atrium. So again, it's quite easy to understand, no? Kapag sinabi po natin na systemic, ito yung mga blood vessels na dinadaanan ng blood para i-distribute or ma-distribute na sila to all the other areas and organs of the body. This slide right here shows us a generalized view of our circulatory system. Alright, so all the blood vessels na manggagaling sa heart and those that would connect to our major organs. So, syempre po, this is just a very simplified version. Malalaman po natin mamaya, no? Yung mga complex pathways that would provide blood to all the other specific areas of the body. So, malalaman natin that there is a specific blood vessel that would supply blood to our head and neck region. Iba rin yung blood vessel na magsusupply ng blood to our upper limbs, lower limbs, and other areas such as those. So, again, this is just a generalized view of the blood flow through our circulatory system. Listed here are the functions of blood vessels. First, they carry blood. Alright, so basically, ito yung magiging daanan, no, ng blood natin para makapunta sila sa lahat ng mga ibang lugar kung saan sila kailangan. Next, this is the site where exchange of nutrients, waste products, and gases would happen within the tissues. So, sa blood vessels natin, dun din daw po, no, nangyayari yung distribution or yung collection ng mga different substances. Alright, so kung nutrients or gases, no, or kung nutrients, for example, this is a distribution of nutrients. Kung waste products, this is a collection of waste products. And then for gases, this is an exchange of gases within the tissue. So all of these processes would happen within the blood vessels. Next, they transport substances. If you've already watched our discussion, no, on the blood and the heart, we would understand na hindi naman mismo yung blood vessels yung nagtatransport talaga ng mga substances. Rather, yung blood po, yung nagtatransport ng substances at daanan po. No? Daanan lang naman yung mga blood vessels. Next is that they regulate blood pressure. So, mamaya, malalaman din natin, no, ano yung mga structures that are included within our blood vessels na nakakatulong sa pag-regulate ng blood pressure. So, hindi lang po nakasalalay dun sa motion ng heart, no? Hindi solely based on the motion of the heart yung blood pressure natin. Pero ayun nga po, may tulong or may ambag din po dito yung blood vessels natin. And next, they direct blood flow to the tissues. So again, ayan po, all our blood goes through the proper places where they need to be because they are being directed by our blood vessels. Let's now know the difference between arteries, veins, and capillaries. So arteries, they carry blood away from the heart. Okay? So, yung mga arteries daw po, ito yung mga daanan, ito yung mga blood vessels kung saan usually yung blood flow sa kanila, no, is away from the heart. So either papunta dun sa pulmonary circulation natin, papunta siya sa lungs, no, or either papunta sa systemic circulation natin. So basically, yung arteries po, ito yung daanan na papalayo sa heart yung direction ng blood flow. So arteries, they have a thick elastic tissue. Alright? Next are veins. So veins naman po, they carry blood towards the heart. Okay? So lahat daw po ng daanan ng dugo na papunta sa heart, those are referred to as the veins. Next are capillaries. These are small blood vessels, no, where exchange occurs between blood and tissue fluids. All right, so capillaries, they're usually made up of a single layer of cells para po madali lang or easy lang yung diffusion ng mga materials papunta dun sa tissues natin. This slide right here talks about a simplified version of our blood flow. So blood would flow from the arteries to the arterioles. No, so arterioles, these are also arteries, just a bit smaller. Next, the arterioles would flow through the capillaries. All right, so yung capillaries po, again, these are the smallest types of blood vessels. Next, capillaries would flow into the venules. So these are basically veins, just a bit smaller. All right. Next, venules would flow into the small veins hanggang yung veins po would return the blood to the heart. All right. So again, this is a simplified, kind of like simplified explanation of how blood flows through our blood vessels. Let's now talk about the layers of the blood vessel walls. So whether we are looking at an artery or at a vein, no, parehas po sila na meron nitong tatlong layers na to. Nagkakaiba lang po sa thickness and composition ng tatlong layers, all right? Depending on whether we're looking at an artery or at a vein. So first up, the tunica intima. So the tunica intima, this is the innermost layer. Nasa pinakalooban po. Right? So, ito rin po yung place that has direct contact with our blood. Alright? So, again, the tunica intima, innermost. Alright? Intima, innermost. And this is composed of simple squamous epithelium. Next is tunica media. Tunica media could be found in the middle. Alright? So, it's quite easy to remember naman, diba? So, intima, innermost, media, middle. So tunica media, this is composed of smooth muscles with elastin and collagen fibers. All right. So again, if you would remember our past discussion on the muscular system, nabanggit po doon, di ba, that smooth muscles could be found on the walls of our hollow organs and also within our blood vessels. So ayun po, specifically, nasa tunica media yung location ng smooth muscles. And the third one is the tunica adventitia. This is the outermost layer, all right? Adventitia, outermost. So this is mostly made up of connective tissue. This slide right here shows us a side-by-side comparison of the microscopic anatomy of an artery, or itong may label na letter A, versus a vein. So ito po na may label na letter V. So notice na both of them do have all three layers. Tunica intima, the innermost, so it is composed of simple squamous epithelium, as we can see right here. Next is the tunica media. So dito na natin makikita yung, kumbaga parang main difference nila, no? Arteries have a much thicker tunica media. So mas maraming smooth muscle cells ang pwede nating makita sa tunica media ng arteries in comparison to veins. And the last one, or the outermost layer, is the tunica adventitia. So again, mainly composed of connective tissues. Again, medyo mas makapal po yung tunica adventitia ng arteries in comparison to veins. So as we can see right here, no, for the veins, it is a bit difficult to distinguish the different layers because they're so thin in comparison to arteries, wherein we have a clear view of all the three layers because they are much thicker in comparison to veins. Next, we have two types of arteries depending on composition. First up is elastic arteries. So elastic arteries, they have a larger diameter. Okay, so mas malawak daw po or mas malaki yung inside nila, large diameter, and they also have the thickest walls. All right, so an example of elastic arteries would include our aorta and pulmonary trunk. Next are muscular arteries. So muscular arteries, in comparison to elastic arteries regarding their size, no, medium to small lang daw po yung sizes ng muscular arteries. Alright? So again, elastic arteries, largest diameter, thickest walls. Pero pag sinabing muscular arteries, no, medium to small lang po yung size nila. They do have a thick diameter, but they're mostly composed of smooth muscle cells. All right, smooth muscle cells, as the name implies, because they are in fact muscular arteries and they can control blood flow through body regions. All right, so ayan po, yung movement ng mga smooth muscles, no, whether the smooth muscles would dilate or open up, or halimbawa naman is magko-contract or magko-close, yung smooth muscles, ayan po, that's how muscular arteries are capable of controlling blood flow. Alright, so ayan po. Again, here are the two types of arteries depending on composition. Again, elastic arteries, they have a large diameter and thick walls, and the main example or ang pinakakilala na examples ng elastic arteries are the aorta and pulmonary trunk. Next, with regards to the composition, no, muscular arteries, as the name implies, no, they contain smooth muscle cells. This slide right here shows us an illustration showing the difference between elastic arteries and muscular arteries. Notice the difference between their tunica media. Unahin po natin yung tunica media, no? So, they contain elastic tissue and smooth muscles. May elastic connective tissue and smooth muscles din naman yung tunica media ng muscular arteries. Pero dito po, no? They are thicker because of the presence of more elastic tissue. Dito naman po, sa tunica media ng muscular arteries, they're composed of less connective tissue, less elastic tissue, but they're composed of more smooth muscles. Alright? So that's the main difference between elastic arteries and muscular arteries. Let's now talk about capillaries. So capillaries have branches to form networks. So mukha daw pong net, no, yung itsura ng mga capillaries as they continue to branch to different directions. And next, no, the blood flow is regulated by smooth muscle cells referred to as precapillary sphincters. Alright? So hindi po katulad ng ibang mga blood vessels na napag-usapan natin earlier kung nasaan the smooth muscles are found at their tunica media, all right? Ang capillaries po, they don't have that, all right? They don't have a tunica media. Rather, yung mga smooth muscle cells po, they could be found around the capillaries, all right? So they would be referred to as precapillary sphincters. We'll better understand this as we look into the illustration on the next slide. Alright, this is what we mean with what we said earlier about capillaries looking like a network. Alright, so sobrang dami nilang branches, nagmumukha na po silang net. Alright, next, for example, no, based on this illustration, the red areas are the arterioles. So again, arterioles are just smaller arteries, and right here are venules. So again, venules are just smaller veins. Alright, so as you can see right here, pagdating dun sa capillary network, we're seeing smooth muscles na imbis na nasa loob or naka-incorporate sa capillaries, they're on the outside. Alright, and they are surrounding the kind of like the entrances or openings or yung susunod na segment ng bawat capillary. So ayan po, that's what we would refer to as the pre-capillary sphincters. So yung mga smooth muscles na naka-encircle kumbaga dito sa mga areas na to. This slide shows us an illustration of the capillaries. All right. So again, as we've seen earlier, no, hindi siya katulad ng arteries and veins. Wala siya nung tatlong layers. Walang intima, media, and adventitia. Rather, it is composed of simple endothelium. Isang layer of cells lang po yung composition niya. And then it is being held together by loose connective tissue. Alright? So, bakit kaya, no? Bakit kaya simple endothelium lang ang composition nito at hindi siya three-layered structure tulad ng ibang blood vessels? It's because usually sa capillaries po nangyayari yung gas exchange, na sa capillaries na po nangyayari yung distribution of nutrients or yung collection of waste materials. So it does make sense na isang layer lang sila para mabilis na magpa-pass through, alright? So hindi masyadong struggle yung exchange or passing through of those materials kasi isang layer of cell lang ang meron yung capillaries, alright? So imagine how difficult it would be to distribute oxygen, collect carbon dioxide, or distribute nutrients kung multiple layers pa yung capillaries natin, diba? So again, capillaries are made up of a simple or single layer of endothelium for easier gas exchange, distribution of nutrients, and collection of waste materials. Let's now talk about veins. So as we've learned earlier, all the three tunics are present in small veins. Okay? So, nakita naman po natin yung side-by-side comparison kanina, di ba? Although mas manipis yung layers or yung tunics ng mga veins, all of them are present. So, again, the innermost is the intima, the middle is media, and the outermost is adventitia. So, again, all of those three tunics are present even in small veins. Now, with regards to size, for medium veins naman po, they collect blood from those small veins and deliver them to the larger veins. Next, the large veins, they contain valves. Alright, so we'll understand this better pagtingin po natin sa illustration on the next slide. So what are valves? This illustration right here just shows us a side-by-side comparison of all the different types of blood vessels that we've mentioned earlier. So again, we have the elastic arteries, the large veins, medium arteries, and then all the other types of veins in comparison to a capillary. So ayan po, dito kompleto na po lahat ng types of blood vessels in terms of their structure. So wag pong kakalimutang aralin yung components ng mga tunics nila. This slide right here shows us what we've mentioned earlier kung saan there are large veins that have valves, all right? So valves are basically these structures that have the capability to open or close as blood is flowing through. So, di ba nabanggit natin na isa sa mga functions ng blood vessels is to make sure, no, that blood is flowing through kind of like a one-way route. So, ayan po. When the valves are closed, it prevents the regurgitation or yung pag-flow pabalik ng blood. And when the valves are open, it helps with maintaining or continuing proper blood flow. So again, valves are structures within large veins that could open and close to maintain or regulate blood flow. Let's now talk about the blood vessels of the pulmonary circulation. So ang purpose or ang work po ng pulmonary circulation is to carry blood from the right ventricle. So galing sa right ventricle, deoxygenated pa po ito. Alright, so it still does not contain oxygen. So pagpunta sa right ventricle, i-deliver niya ito papunta sa lungs. Pagdating sa lungs, that's where our blood would acquire the oxygen. And then after that, it would go back from the left atrium of the heart. So pagdating sa left atrium no heart, oxygenated na yung blood. Alright, so that's what happens within the pulmonary circulation. Next, we have what is known as the pulmonary trunk. So the pulmonary trunk is, this would carry the blood from the right ventricle towards the lung. Okay, so yung daanan daw po ng dugo galing sa right ventricle para mapunta sa lungs, dadaan muna sa pulmonary trunk. Next, we have the pulmonary veins. So they exit the lungs and carry the oxygen-rich blood to the left atrium. Alright, so pagkatapos daw manggaling sa lungs, pagkatapos nilang makapag-acquire ng oxygen galing sa lungs, no, dadaan muna po sila sa pulmonary veins para mapunta sa left atrium. This slide right here just shows us a general view of the location of all the major arteries throughout our body. Alright, so again, if you belong to my laboratory classes, isa po ito sa mga kailangan niyong tandaan, kailangan niyo pong aralin. Alright, so again, do not forget the location of our major arteries in the body. Let's now talk about the blood vessels involved in systemic circulation. So systemic circulation would carry blood from the left ventricle to the tissues. Alright? So pagkagaling sa left atrium, ipupush ng left atrium yung blood papunta sa left ventricle. Pagdating sa left ventricle, ipupush nung left ventricle yung blood to all the other tissues of our body. Alright, so ayan. Next bullet, oxygenated blood from the pulmonary veins would pass through the left atrium and then to the left ventricle and then into the aorta. So pagkagaling daw po sa left ventricle, ipupush or ipapump ng left ventricle yung oxygenated blood papunta sa aorta. Next, the arteries distribute blood from the aorta to all the portions of the body. So, yung aorta po, may mga branches ito. And then after that, there would be further branching, as we go through the outside of the general location of the heart. So, ayun po. So, that's how our heart is capable of pumping or delivering the oxygenated blood through the rest of the body. Let's now talk about the different parts of the aorta. So, ayun po, for this segment, I highly suggest that you have a photo of the heart on hand or near you para po as we're reading or describing these different parts is meron din kayong picture na matitignan. So first up, we have the ascending portion of the aorta. It passes superiorly from the left ventricle. So nasa bandang itaas daw po yung dinadaanan ng ascending aorta. Next is the aortic arc. So the aortic arc contains 3 major arteries which would carry blood from the aorta to the head and upper limbs. So yung aortic arc po, ito yung pinakamalaking curve na makikita natin sa ibabaw ng heart. Tapos may tatlong parang branches pa siya. Alright? Or yung tinatawag na 3 major arteries. So dito po, yung mga branches na to, it mainly supplies blood to the head and upper limbs, meaning yung arms natin. Next, the descending portion of the aorta would extend through the thorax and abdomen to pelvis. So, ayun po, medyo madali naman tandaan, di ba? Yung descending, yung mga mas mabababang areas na po. No, nandun na natin ma-observe yung descending aorta. Next is the thoracic portion of the aorta. This is part of the descending aorta that extends through the thorax to the diaphragm. Alright? So, kanina, diba, nabanggit natin yung existence ng descending aorta. Alright? So, a portion of the descending aorta is referred to as the thoracic. So, ayan po, as the name implies, no, we could be able to understand that it extends through the thorax hanggang sa diaphragm. Next is the abdominal portion. The abdominal is also a part of the descending aorta. Okay, ulitin po natin yung descending aorta. It's further divided into the thoracic and abdominal. So this one would extend from the diaphragm where it divides at the common iliac arteries. So we'll better understand this as we look through the illustrations on the next slide. Alright, so if you have a copy of your Seeleys, no, if you have a PDF copy of your Seeleys, I highly suggest po that you zoom in on these photos para maintindihan po natin yung location ng iba't ibang mga parts of the aorta or branches of the aorta na na-mention po natin kanina. Let's now talk about the arteries of the head and neck. Dito po sa mga susunod na slides, I highly encourage you to just focus on the parts that I have highlighted. Alright? Focus na lang tayo doon sa mga may highlight. So first up is the brachiocephalic artery. So this is the first branch of the aortic arc. So kanina, di ba, natutunan natin that the aortic arc is kind of like that big curve na nasa ibabaw no, or nasa superior or topmost portion ng heart natin. And it is divided into three branches. All right. So again, the first branch of the aortic arc is the brachiocephalic artery. All right, so it supplies blood to the right side of the head and neck. All right, so wag pong kakalimutan yon. Okay, again, our head and neck, specifically the right side, it receives blood through the brachiocephalic artery. Next, we have the left common carotid artery. This is the second branch from the aortic arc. So this one would provide blood to the left side of the head and neck. Alright, kung kanina, yung right side ng head and neck region natin, yung dugo dito ay nanggagaling sa brachiocephalic. Dito naman po, yung left side ng head and neck natin, the blood from these areas is being supplied by the left common carotid artery. Next is the left subclavian artery. So this is the third branch from the aortic arc, and it supplies blood to the left upper limbs. All right. So left upper limbs meaning yung left arm natin, diba? All right. So again, the blood from our left arm comes from the left subclavian artery. Still on the arteries of the head and neck, next is the right common carotid artery. All right, so the right common carotid artery, this branches off from the brachiocephalic artery. All right, so notice po, di ba, may mga major arteries tayo, tapos patuloy lang silang nagba-branch off to different areas. And those different branches would supply blood to different places. All right, so ulitin natin, mula dun sa brachiocephalic artery, meron siyang branch na tinatawag na right common carotid artery. So this would supply blood to the right side of the head and neck. Alright, so nagsusupply din po ng blood to the right side of the head and neck region ang right common carotid artery. Next is the right subclavian artery. This also branches off from the brachiocephalic artery. Alright, so wag pong kakalimutan yung mga different branches ng brachiocephalic artery. So the right subclavian artery, this would supply blood to the right upper limbs. So our right arm, no, yung blood daw po sa right arm natin ay nanggaling sa or sinusupply ng right subclavian artery. Ang right subclavian artery ay nag-originate or nag-branch galing sa brachiocephalic artery. Alright, again, if you belong to my laboratory classes, huwag pong kakalimutan na aralin itong mga parts na ito. Alright, itong mga labels na nakikita natin dito. And of course, kung saan po yung area na sinusupplyan nila ng dugo. I will no longer be discussing in full detail itong cerebral arterial circle, pero syempre, no, aaralin nyo pa rin po ito kasi alam nyo naman sa mga practicals, hilig nilang magtanong ng mga ganito. Alright, so again, for our upcoming practicals, no, just to be safe, please study yung cerebral arterial circle. Let's now talk about the arteries of the upper limbs. Again, let's focus on those with highlights. First up is the brachial arteries. So this is where blood pressure measurements are taken. Alright, so yung brachial arteries po, this could be found at the upper portion of our arm. Kaya po, di ba, yung mga BP cups, dun po iniikot or nilalagay sa upper arm natin right above the elbow. Kasi nandun din located yung brachial artery. So again, brachial arteries, this is where blood pressure measurements are taken. Next are the ulnar arteries. Huwag kakalimutan that this is a branch of the brachial artery. Alright, so again, notice, no, we talk about the major arteries and then patuloy silang nagba-branch off into different areas. So again, the brachial artery further branches into the ulnar arteries. So this one is located near the elbow. Next are the radial arteries. This is also a branch of the brachial artery. And ito naman po yung area where pulse can be taken. Alright, so ayan po, wag kakalimutan ha, blood pressure could be taken from the brachial artery, whereas our pulse rate could be taken from the radial arteries, or the area near our wrist. Again, if you belong to my laboratory classes for quiz purposes, wag pong kakalimutang aralin yung mga labels dito sa picture na to. Alright? So, wag po natin kakalimutan yung locations ng iba't ibang mga arteries na napag-usapan natin on the previous slides. Let's now talk about the abdominal aorta branches. First up is the celiac trunk. All right, so the celiac trunk, this would supply blood to the stomach, pancreas, spleen, liver, and also the upper portion of the duodenum. So, medyo maraming segments po nung digestive tract natin ang sinusuplayan ng dugo ng celiac trunk. Alright, so again, celiac trunk supplies blood to the stomach, pancreas, spleen, liver, and upper duodenum. Next is the superior mesenteric arteries. So this one would supply blood to the small intestines and upper portion of the colon, or yung bandang itaas daw po ng large intestine. Alright, so the colon is otherwise referred to as the large intestine. So again, the superior mesenteric arteries would supply blood to the majority of the small intestines and the upper part of the colon or large intestine. Next, it's the inferior mesenteric arteries. Alright, so inferior, nasa medyo mas baba na siya, diba? So inferior mesenteric arteries would supply blood to the colon or to the majority of the large intestine. Alright, ulitin natin, kapag superior mesenteric, karamihan ng sinusuplayan niya nasa small intestine. Pero kapag inferior mesenteric, karamihan po ng sinusuplayan niya ay yung large intestine or colon. Still on the abdominal aorta branches, these ones are quite easy to remember. Alright, nasa pangalan na po nila yung organs na sinusuplayan nila. So the renal arteries would supply blood to the kidneys, hepatic arteries would supply blood to the liver, testicular arteries would supply blood to the testes, and the ovarian arteries would supply blood to the ovaries. Alright, so again, these ones are very easy to remember. Nasa pangalan po nila yung organ na sinusuplayan nila. Still on the abdominal aorta branches, next is the inferior phrenic arteries. This would supply blood to the diaphragm. Alright, so ang diaphragm daw natin, nakakakuha siya ng dugo from the inferior phrenic arteries. And next, the lumbar arteries. Again, this one is quite easy to remember. Nasa pangalan niya yung organ or yung region na sinusuplayan niya. Alright, so the lumbar arteries would supply blood to the lumbar vertebra and also the back muscles. Let's now talk about the arteries of the lower limbs. So if you would notice, simula dun sa mga previous slides kanina, dito po, no, karamihan memorization na lang po talaga because very direct to the point naman po yung mga laman ng mga slides natin dito. So, sinasabi lang kung ano yung pangalan ng artery and kung ano yung specific organ or area na sinusuplayan nila ng blood. Alright? So, these ones, again, are the arteries of the lower limbs. So, first up are the femoral arteries. Alright? So, the femoral arteries, they would supply blood to the thighs. Next is the popliteal arteries. They supply blood to the knee. Next, the anterior and posterior arteries would supply blood to the leg and foot. And then the fibular arteries would supply blood to the lateral leg and foot. Alright, so dito po, no, para po madali nating matandaan, for femoral arteries, no, nasaan ba yung femur natin? Nasa thigh area, diba? So femoral arteries would supply blood to the thigh. Again, isa na naman pong tip para sa mga laboratory classes ko, no, for our upcoming quizzes. Huwag pong kakalimutan na aralin itong mga pictures na to so that you may be able to identify the major arteries of the lower limbs. Alright, so let's now talk about veins. Ang dami na po nating napag-usapan. Arteries pa lang po yun. Okay, may mga veins pa po. So the veins would return blood to the heart. So kanina, yung mga arteries po, yung mga pinapoint out natin na places, puro areas kung saan nila susuplayan ng dugo. Diba? Dito naman sa veins, pag-uusapan natin yung mga blood vessels kung saan they would drain the blood. Okay? So, ayan po. In the systemic circulation, the blood returning to the heart is deoxygenated. So, yung mga blood po na na-deliver na yung oxygen content nila, no? Dito na sila dadaan sa mga veins. So, tatawagin natin silang deoxygenated kasi naipamigay na nila, na-deliver na nila sa mga tissues yung oxygen na dala nila. In the pulmonary circulation, the blood returning to the heart in the pulmonary veins is oxygenated. Alright? So, sa pulmonary circulation naman po, yung mga veins, ang blood na dumadaan sa kanila ay oxygenated. Kasi po, nakahingi na sila ng blood, nakahingi na sila ng oxygen galing dun sa lungs. Alright? So, ulitin po natin yan. Kapag sinabing systemic circulation, the blood that is passing through the veins is deoxygenated, does not have oxygen. Pero kapag pulmonary circulation po pinag-uusapan natin, the blood that is passing through the veins are oxygenated. They have already acquired oxygen from the lungs. First on our list is the superior vena cava. So the superior vena cava would return blood from the head, neck, and thorax, and it would empty the blood or deliver the blood to the right atrium of the heart. Okay, so yung blood daw po na deoxygenated na, okay, nagastos na yung oxygen nila, yung mga blood na nanggaling sa head, neck, and thorax area, dito po sila pupunta or dadaan sa superior vena cava. Alright, pagdaan nila sa superior vena cava, pupunta sila sa right atrium. Next, the inferior vena cava would return blood from the abdomen, pelvis, and lower limbs. So, ayun po, naayon naman sa pangalan nila yung places kung saan nanggaling yung blood. So, superior vena cava nanggaling sa superior or upper portions yung deoxygenated blood. Dito sa inferior vena cava nanggaling sa lower segments of the body yung deoxygenated blood. So, again, inferior, it would drain blood from the abdomen, pelvis, and lower limbs. But one thing that they have in common is parehas sila na papunta sa right atrium, yung blood na kukunin nila. Again, this illustration shows us all the major veins in our body. Let's now talk about the veins of the head and neck. So ito daw po yung mga veins that would drain blood from the head and neck region. First up is the external jugular vein. So this would generally drain blood from the head and neck. Now, in comparison, we have what is known as the internal jugular vein. So, yung internal jugular vein po, mas specific yung areas kung nasaan nanggagaling yung blood na dinadrain niya. So, kung yung external jugular po, head and neck in general, yung internal jugular po, it drains blood from the brain, face, and neck. Okay? So, yun po yung difference. Okay? The external jugular, it drains blood from the head and neck region in general. Pero yung internal jugular vein, it drains blood specifically from the brain, face, and neck areas. Next, we have the subclavian veins. The subclavian veins would form the brachiocephalic veins. Alright, so kung kanina meron tayong brachiocephalic artery, of course, may counterpart yun. And we also have the brachiocephalic veins. Now, the brachiocephalic veins would join to form the superior vena cava. And if you would remember from the previous slides, diba po, the superior vena cava would drain blood from the upper portion of our body. This illustration right here shows us the veins of the head and neck or yung mga na-discuss po natin sa previous slide. Again, if you belong to my laboratory classes, here's a tip. Huwag pong kakalimutang aralin ito for our upcoming quizzes. Let's now talk about the veins of the upper limbs or yung veins ng arm natin. Alright, so naka-highlight po dito yung median cubital vein. Alright, so it connects to the cephalic vein and it is near the elbow. Ang pinaka-notable description ng median cubital vein natin is that this is our first choice for performing venipuncture or phlebotomy. Alright, so pagdating nyo po sa PMTP2 classes nyo, in PMTP2, you would be taught the different techniques of collecting blood. So again, blood collection or blood sample collection for different methods of testing is referred to as phlebotomy or venipuncture. So literally, we would puncture a vein. And ang first choice of vein natin is the median cubital. Kasi po, this one, for a lot of people, this one is the easiest one to find. And also, it's the most stable out of the three choices. Alright, so tingnan po natin yung illustration on the next slide. All right, so in phlebotomy, all right, or in venipuncture, the process of collecting blood for testing, we have three choices of veins kung saan pwede po tayong kumuha ng blood sample. Yung median cubital, yung cephalic, or yung basilic, as we can see right here in this illustration. Again, ang first choice natin is the median cubital vein because this one is the easiest one to find and it is the most stable. All right, ulitin natin, the median cubital vein is the most stable or well-anchored vein. So basically, hindi siya ma-out of place or biglang magro-roll or kikilos, no, kapag po we start inserting the needle. Alright? Pero in comparison to the others, medyo mas less stable po yung cephalic and basilic vein. Kaya first choice ang median cubital. Second choice is the cephalic vein or the one that is here on the outside. Alright? And ang third choice po is the basilic vein. If possible, hindi talaga natin pinipili ang basilic vein. First up, it's very unstable. Madali siyang mag-roll or ma-out of place. And second, medyo mas marami pong nerves sa area na to. So, if you accidentally hit a nerve with a needle, this could cause pain and discomfort for the patient. So, again, it is being said na third choice yung basilic vein, pero kung pwede, no, kung kaya naman nating hanapin and mahit yung median cubital or yung cephalic, we really do not choose to look for the basilic vein. So, and po, here are the veins of the upper limbs. Let's now talk about the hepatic portal system. So this is the vascular system that begins with capillaries in the viscera and ends with capillaries in the liver. Alright, so again, as the name implies, hepatic portal system, nasa liver. Alright, so it uses the splenic vein and superior mesenteric vein. Again, may illustration po on the next slide for us to understand. Alright, so here is the hepatic portal system. So ito po yung lahat ng veins that would drain blood from the different organs that is involved in our digestive system. Alright, so nakikita natin dito yung liver, gallbladder, our stomach is right here, and then all of our small intestines and large intestines. Alright, so pinapakita po dito yung location ng mga veins that would drain blood from these areas. Let's now talk about the veins of the lower limbs or yung mga legs po natin. First up is the femoral veins. Again, this one is quite easy to remember. Nasaan ba ang femur? Nasa thighs. So this would drain blood from the thigh. Next is the great saphenous vein. This would drain blood from the foot. Next is the popliteal vein. So same lang din naman sa popliteal arteries, it would drain blood from the knee. Okay, so ulitin po natin yon. Femoral veins, this would drain blood from the thigh. Yung kabaliktaran niya, yung femoral arteries, it supplies blood to the thighs. Next is the popliteal veins. No? It drains blood from the knee. Ang kabaliktaran nito is yung popliteal arteries, which supplies blood to the knee. Again, this slide shows us an illustration of the location of the veins of the lower limbs na na-discuss natin on the previous slide. Again, if you belong to my laboratory classes, huwag pong kakalimutan na aralin itong mga to. Let's now just quickly talk about blood pressure. So as we've mentioned on the previous slides, no, blood pressure is taken from our brachial artery. Alright, so yung specific artery kung saan pwede nating ma-measure ang blood pressure is nasa brachial artery. But by definition, blood pressure is the force that blood exerts against our blood vessel walls. Alright, so yung puwersa ng pagdaan ng dugo through our blood vessels. So the systolic blood pressure, this is brought about or this is caused by the contraction of the heart. And then the diastolic blood pressure, this is brought about by the relaxation of the heart. Alright, so ulitin po natin, systolic, contract, diastolic, relax. Okay, so the average blood pressure for normal healthy humans is at 120/180. Let's now talk about pulse pressure. Again, yung pulse natin, pwede natin itong ma-measure through our radial arteries, diba? So pulse pressure, this is the difference between the systolic and diastolic blood pressure. So if, for example, ang normal is 120/80 or 120 for systolic and 80 for diastolic, then by computation, a person's pulse pressure would be 40. All right? This photo right here shows us all the other areas where we may be able to observe pulse rates. All right, so ayan po, ang common area wherein we may observe pulse rates is at the radial artery or yung nandito po sa wrist area. But as you can see in this labeled photo, marami pa pong ibang places kung saan pwede tayong makapag-observe ng pulse rates. Let's now talk about capillary exchange. Most exchange of materials like oxygen, carbon dioxide, nutrients would happen across capillary walls, and this occurs by diffusion. So blood pressure, capillary permeability, and osmosis would affect the movement of fluids across capillary walls. So ayun po, sinasabi lang naman dito that the exchange of materials happens in the capillaries, which is why yung structure po nila is they're made up of only simple epithelium or just a single layer of epithelium. Let's now talk about local control of blood flow. So local control is achieved by the relaxation and contraction of precapillary sphincters. Now, if you'd remember from the illustration that we've seen a few slides ago, di ba yung mga capillaries po natin, they have multiple branches and they kind of look like a mesh or a net, di ba? They're kind of like a network. And then there are specific segments on the capillaries that have smooth muscles surrounding them. So yun po yung mga precapillary sphincters. So when the sphincters relax, blood flow would increase. And then precapillary sphincters are controlled by metabolic needs of tissues. So concentration of nutrients also control blood flow. So blood flow increases when oxygen levels decrease. Alright, so depende po sa pangangailangan ng tissues kung kailangan niya ng mas maraming supply ng nutrients, kailangan ba niya ng mas mataas na levels ng oxygen, then magre-relax yung precapillary sphincters para tuloy-tuloy yung dadaanan or malawak yung dadaanan ng blood flow. Na kung halimbawa, there is excess of something, kung kunyari sapat naman na yung oxygen sa isang area, sapat naman na yung nutrients sa isang area, or kung halimbawa, hindi naman kailangan ma-deliver itong isang material na to sa isang place, then maybe the precapillary sphincters would contract or they would kind of like close off some segments of the capillaries. So yun po, that's how local control of blood flow is achieved. This illustration right here shows us the relaxation and contraction of precapillary sphincters. So, yung mga smooth muscles na nakikita po natin dito, yun yung mga sphincters. So, when they are relaxed, tuloy-tuloy po yung blood flow. So, blood flow could increase. But when they are contracting, alright, they are closing off a certain area. So, blood flow would be decreased in the area kung saan sila nagsarado. Let's now talk about the nervous control of blood flow. So, saan daw po pumapasok yung nervous system natin with regards to controlling the flow of blood. So, we have what is known as the vasomotor center. So, this is located in the pons and the medulla oblongata. Alright, so wag pong kakalimutan yun. Dalawang areas wherein we have the vasomotor center. It's located at the pons and the medulla oblongata, and this would control blood vessel diameter. Alright, so kung kakalimutan yung mga areas sa may highlights, next is the vasomotor tone. The vasomotor tone is the state of partial constriction or pagliit daw po nung daanan ng mga blood vessels natin. So the increase causes blood vessels to constrict and blood pressure to go up. So kapag nangyayari po yung partial constriction, umaangat daw po yung blood pressure natin. So if we have a nervous control of blood flow or may ambag daw po yung nervous system natin sa blood flow natin, we also have a hormonal control of blood flow. Alright? So may tinatrabaho din po yung endocrine system natin that has something to do with controlling our blood flow. So the sympathetic division would regulate the hormonal control of blood flow through the release of epinephrine and norepinephrine from the adrenal medulla. All right, so these hormones would cause constriction, which reduces blood flow. Magko-constrict daw po or liliit yung diameter ng blood vessels natin to reduce the flow of blood. Now, in some tissues, such as skeletal muscles, cardiac muscles, these hormones could cause blood vessels to dilate, increasing blood flow. Ulitin po natin yon, yung hormones na epinephrine and norepinephrine na nanggaling sa adrenal medulla, pwede daw po nilang maapektuhan yung skeletal muscles natin and yung cardiac muscles natin, causing them to dilate. Pag nag-dilate po yung mga blood vessels sa areas na ito, this would increase blood flow. So, dadami daw po yung supply of blood sa mga areas na ito. Which, if you would remember from our discussion on the endocrine system, yung epinephrine and norepinephrine po, diba? This has something to do with our fight or flight response, diba po? So, ayun po. Ang epinephrine and norepinephrine, it would cause an increased supply of blood for our skeletal muscles and cardiac muscles to prepare us for stressful situations or increased physical activity. Alright, so yun po yung connection between epinephrine and norepinephrine and their influence in blood flow. This slide shows us the step-by-step process of the adrenal medullary mechanism. So, ayan po. First up, a stimuli would increase the sympathetic stimulation of the adrenal medulla. So, may external stimuli daw po na, kumbaga is parang magte-trigger sa adrenal medulla natin. So, the adrenal medulla would now secrete epinephrine and norepinephrine. So, this causes an increased heart rate and stroke volume and also vasoconstriction. Alright, ulitin natin. Pag nag-release daw po yung adrenal medulla ng epi and norepi, this would lead to three things: increased heart rate, stroke volume, and vasoconstriction. Alright? Next, there would be vasodilation on specific areas naman po in our body, particularly sa skeletal muscles natin and cardiac muscles. So basically, ang mangyayari po, magko-constrict yung blood vessels natin to all the other areas of our body, pero magdadilate sa skeletal and cardiac muscles natin. So, mas i-direct or mas bibigyan ng increased blood flow yung skeletal and cardiac muscles natin. Okay, so as we can see right here in this illustration, ang step 1 is there would be an increased stimulation. So, may madedetect po tayo na stimuli. Again, either it's a stressful situation or the need for increased physical activity. So, magtatrabaho na po yung medulla oblongata natin para i-deliver yung message sa adrenal medulla. Pagdating sa adrenal medulla, magsa-secrete ito ng epi and norepi. Pag na-secrete na yung epi and norepi, magko-constrict yung blood vessels natin in some of the other areas of our body, pero magdadilate yung blood vessels to our cardiac muscles and skeletal muscles. So, providing an increased amount of blood flow, specifically to our skeletal muscles and heart muscles to prepare them for, for the stressful situation or for the increased physical activity. Let's now talk about the effects of aging on blood vessels. First up, we have the term arteriosclerosis. Arteriosclerosis. This makes the arteries less elastic. So, if you would remember our discussion on the integumentary system, di ba po, yung skin natin, as a person ages, there would be decreased production of collagen fibers, decreased production of elastic fibers, affecting the integrity of our skin. So, parang ganun din po yung blood vessels natin. So, as a person ages, the blood vessels also become less elastic. Next, we have the term atherosclerosis. Atherosclerosis. This one is a type of arteriosclerosis. Alright, ulitin po natin, no? Ang atherosclerosis ay isang uri lang po ng arteriosclerosis. So, this happens when there is a deposit of materials on the artery walls. For example, plaques of cholesterol. Alright, so may mga nakadikit daw po ng mga bagay dun sa arteries natin. So, isa yun sa mga pwede nating ma-observe as a person is aging. Alright, so let's look at the factors that could contribute to atherosclerosis. Lack of exercise, alright, so kapag sedentary daw po yung lifestyle ng isang person, maaaring magkaroon ng mga deposits of yun nga, plaques or cholesterol dun sa blood vessel walls. Smoking, obesity, diet that is high in cholesterol, ayan na nga po, paulit-ulit nating nababanggit, no? It really gives a negative effect kapag high cholesterol po yung mga pagkain na kinakain natin. High cholesterol and trans fat, and sometimes genetics also play a role in these kinds of things. So, di ba po, in taking patient history when you're at the doctor's office, madalas tinatanong nila, di ba, may history po ba ng high blood? May history po ba ng kahit anong cardiovascular disease? Kasi ayun nga po, genetics could also play a role in these types of conditions. If you belong to my lecture classes, that ends our discussion on blood vessels. Thank you so much for listening. If you belong to my laboratory classes, let's now proceed to the study on the microscopic anatomy of blood vessels. This slide right here shows us another side-by-side comparison of an artery versus a vein. Okay? So again, although mas malaki po yung vein na nandito sa picture, mas makapal pa rin po yung layers ng mga arteries. Alright? So again, the tunica adventitia in some references, alright, in some references, this is also referred to as the tunica externa. Okay? But for the purposes of our upcoming exams, quizzes, ang susundin po natin ay kung ano yung natutunan natin sa Seeley's, okay? Which is tunica adventitia. Alright? So again, the tunica adventitia, this is the outermost layer. Yung tunica media, this is the middle layer, which is composed of mostly smooth muscles. And then the tunica intima, this is usually composed of endothelium. Alright, so it's the same for arteries and veins. It's just that arteries have much thicker tunica media. And this slide right here shows us a microscopic sample that has kind of like a mix of everything, alright? So ayan po, kailangan kahit ganito karaming components yung nakikita natin dun sa sample, kahit ganito karaming components yung ipinakita sa atin, kailangan we have to learn how to identify each of them. Alright, so let's start with this one. Again, this one is an example of an artery. Alright, so the tunica adventitia, or the outermost layer, this is mostly composed of connective tissues. Yung tunica media, this is composed of smooth muscles, di ba po? And then the innermost layer, or yung tunica intima, this is composed of endothelium. And then yung nasa gitna po, yung space in the middle, where it's empty and dito po dumadaan yung mga blood that flows through, is the lumen. Next, let's look at this vein right here. So as expected, mas manipis po yung layers ng veins, alright? So here is the veins tunica adventitia. Right here is the tunica media. So manipis lang po yung layer ng smooth muscles niya. And then it's a bit difficult to distinguish, no, with its tunica intima. So again, sobrang nipis lang po kasi ng mga layers. And then the inside that is hollow, we would refer to that as the lumen. Right here, we're being shown smaller arteries and smaller veins, or yung mga arterioles and venules, diba? And then this specimen right here is surrounded by adipose tissues, and right here on top we're seeing also nerves. Alright, so kapag may nakita tayong mga ganito, most likely these are nerves. Ano pong palatandaan? Paano natin malalaman na nerve ito versus kung blood vessel ito? Blood vessels are hollow on the inside, diba? Meron silang lumen. As we can see right here, even the smaller ones. This one has space on the middle. This venule right here also has a lumen in the middle. But the nerves, they don't have that. They're one solid structure, diba po? So that's how we would be able to differentiate upon microscopic anatomy kung nerve ba or blood vessel yung tinitingnan natin. This slide right here shows us a side-by-side comparison between an artery, a capillary, and a vein. So, ayan po, by this time, sana po very familiar na kayo sa difference between an artery and a vein. Although medyo mas malaki yung diameter ng mga veins or yung mga openings nila, mas manipis yung mga layers nila in comparison to arteries that they obviously have this very thick tunica media or ayun nga po, makapal yung area kung saan merong mga smooth muscles. Right here in the middle, we're seeing a capillary. So again, capillaries are only composed of simple endothelium or single layer of cells lang po for easier diffusion of materials, diba? Kailangan madali pong makakapag-pass through yung oxygen, carbon dioxide, nutrients, and waste materials. So what we're seeing right here is the simple endothelium of capillaries, all right? So single layer of cells lang po. And of course, the hollow space in the middle, that is the lumen of the capillary. So ayan po, again, side-by-side comparison of an artery, capillary, and vein. That ends our discussion on blood vessels. Again, I am Aurel Enriquez. Thank you so much for listening.